Hi guys, my name's Zoe from Chi Medicine in Moonee Ponds, Melbourne, Australia. And today, as a Chinese medicine practitioner, I am here to talk to you about endometriosis. So I've just put out a blog and I just wanted to give you some of the highlights and talk about it because there are so many people that have endometriosis. Specifically, there is 1 in 10 women in Australia that is diagnosed with endo at the moment, and I'm sure that there's so many more out there. It also affects 50% of women with infertility, and this is just absolutely out of control. We don't want that. So what can we do about it? What is it? How is this affecting people? So endometriosis, starting with, is a condition where a tissue that resembles the uterine lining grows and develops in places that it's not meant to be. So where isn't it meant to be? That would be the fallopian tubes, the ovaries, the bladder, the bowels. It could be anywhere. So generally, normally, what happens is our uterine lining will grow and become more and more lush by replicating, and then with the influence of the hormones, it will shed and we get a period every month. So what happens if endometrial tissue is not in the right area? So the uterus, it can't shed. It does exactly the same thing, and generally PMS and during the period, this is where women get their most pain, is because it does that. It sheds and then it tries to go out of the body like a period, but it can't, so it gets stuck and it causes inflammation, excruciating pain for a lot of women, some women maybe not so much, and lots of swelling, and we don't want that. Endometriosis is different though to a lot of reproductive conditions, because generally the ovulation is working quite normally. The only issue is that there's a physical blockage. Things can't get through, especially if it's in the fallopian tubes or in the ovaries, that it's actually physically stopping things from getting through. And so unlike PCOS, where there's more of a hormonal changes and all that kind of thing, it's different, and so it's treated differently. What does Western medicine do as a treatment? 1, there's drugs. Drugs that can help to relieve the pain and tries to stop the growth of the endometrial tissue. But the problems with this is either it can put you into like a menopause-like state, or some of the medications can even trick your body into being pregnant, which, if you want to be pregnant and you're using it to try to conceive, it is not a great idea. The other thing is there's side effects, and side effects can include, but not limited to, weight gain, mood disorder, acne or hormonal imbalances, even headaches, which we don't want, because that is just another side effect already to add to the pain and inflammation of endometriosis. The other thing is surgery. Surgery can go in and clear out the endometrial tissue buildup, and although it's not treating the root cause, but sometimes it is necessary, especially when we're trying to conceive, because if there's significant amount of build-up, it could take a long time to clear up, and sometimes that surgery can actually help to quicken that, which is a good thing. But how do we see it in Chinese medicine? Quite similar. So in Chinese medicine, we also see it as a blood stagnation, so that build up, that blockage, depending on what it's from, where did the blood stagnation come from, there can be so many different patterns. So you might have, another pattern that's causing the blood stagnation, or maybe the blood stagnation is coming from diet, or maybe it's coming from a lack of exercise. There is so many different things. There's also different patterns that are like working together. So it's not just blood stagnation, generally. If it is, that's could be easier to clear out. But generally, there's a whole bunch of different things. And so I can't give you one classic example, or I guess direction in this is how we do it, because everyone is individual and there are so many different ways that unfortunately you would have to talk to your Chinese medicine practitioner to work out exactly what yours is, exactly where it's coming from, and exactly how to fix it. And so how do you fix it? How do we work in Chinese medicine? We use acupuncture mainly, can help to relieve pain that you're getting from the endometriosis, help to try and regulate hormones and bring the whole picture back together. But reducing that pain by getting rid of that is just so important. And then we have tools. We have so many tools. Just a couple that's on the blog if you wanted to go further is a castor oil pack. Castor oil packs can be super helpful in helping to move that stagnation and relieve pain. Also, we might recommend diet. So anti-inflammatory diet can be really helpful in not causing more inflammation. And turmeric, if you haven't tried it already, is really great for clearing out blood stagnation in our terms, and relieving that inflammation. So check them out. You can get more on the website and through the post itself, which should be down the bottom. And so, are you fed up with endometriosis? Are you trying to conceive with endometriosis? Come and have a chat to us. We will do an online talk with you, see if it's for you, see if it's not for you. Otherwise, check out our website, www.qimedicine.com.au, and like our video, get it out there, let us help everyone, because we want everyone to be healthy, and we don't want anyone to be suffering with pain and all the stuff that goes with it when we know we can help. So great, have a great day, and hopefully I'll see you soon. Thank you.